Hi, everyone. This is Todd, the Director of Content at Beyond Type 1. I'm here today speaking with Ashlee Ernst. Ashlee is a nurse. She has type 1 diabetes, and she also tested positive for coronavirus. So she has been gracious enough to join me for a quick video interview to share what the experience has been like for her. Ashlee, do you want to add anything else or introduce yourself a little bit more?
Yeah, so I work as a nurse here in Denver, Colorado at the Barbara Davis Center. So I get to work with people with diabetes all day, which is really exciting. I myself have had type 1 diabetes for 15 years. And I was tested positive for coronavirus about a week and a half ago.
Great. And if you don't mind me asking, because I think it is relevant, there's a lot of statistics about how old people are who have been getting coronavirus.
Yeah,
How old are you?
I'm 25.
Okay, so pretty young, I think,
Yeah,
for what we've been
right.
seeing.
hmm
Um, so why did you get tested initially? Were you
Right.
showing symptoms? Had you been in contact with someone who had tested positive?
Yeah. So I had started having headaches, and I just kind of wrote them off like no big deal. It could be related to X, Y, or Z. And then I got a message from a friend that they had tested positive, and people in their family had tested positive. So I knew that I had been in close contact with them in the past week. And so through work, they had me call into like a health line, and they decided to test me because I have type 1 because I'm a nurse. And I was showing mild symptoms.
Can you tell me a little bit more about those symptoms? Did you have a
Yeah.
temperature? What have the symptoms been
Yeah.
like, I guess, at the beginning and then also throughout the past week and a half?
Yeah. So my symptoms at the beginning just started as a headache and then turned to like sinus pressure and then some sinus congestion. I really don't fit the textbook coronavirus symptoms. I never had a fever and I didn't have a cough. I really stuck with headache, exhaustion, um, some sinus congestion, and then some shortness of breath after walking upstairs, kind of like some recovery breaths after that. So I think that's a good reminder for people that coronavirus shows up differently in everybody. We have those basic or main symptoms that a lot of people are seeing, but it really can present or not present in people, and they can still be positive. So
Yeah, so it sounds like the case has been pretty mild for you. Do you
yeah.
think, were this not going on, is it something you even, like, would you have even seen a doctor about these symptoms? What do you think, how do you think your reaction would have been with these types of symptoms, like, say, a year ago?
Yeah, absolutely. I definitely think I would not have seen a provider if we were in this epidemic. So yeah, I definitely would have not seen somebody about it.
Yeah. So I guess it is an important reminder that even if, you think you're not that sick, it is really important. It's just stressing the importance of isolation and social distancing. And I do want to ask about that. So since you've tested positive, how have you been kind of isolating yourself, or what have you been doing to, yeah.
Yeah. I kind of went on lockdown. I haven't been to work for a couple weeks. I was thankfully diagnosed on a Monday, so I wasn't at work that day. We have moved to all telehealth pretty much. So haven't been around anybody except the people that I live with. And even them have been on quarantine too. I was released from quarantine this past couple of days since my symptoms. I hadn't had symptoms for 7. It was 7 days since my first symptom, or 3 days after my last symptom. It's very confusing regulations that they've put on it. But yeah, haven't seen anybody. I'm doing a lot of FaceTime to stay in contact with people. But yeah, have stayed home for the past 2 weeks now. It's going on.
And so when do you know officially that you're like clear to go back into society, clear to go back into work?
Right. So I actually got a call from my health department here locally, telling me when I could return back to work, as well as our employee health. So I followed their guidelines. Right now, they were saying 7 days after your first symptom or 3 days after your last symptom, whatever's longer. And so mine was 7 days after my first symptoms, because my symptoms were so short. They were only a couple of days. And then I'm supposed to wear a mask for 2 weeks once I'm out in public, interacting with people.
So they don't do like another test to try to get a negative test?
No, as of right now, they're not doing that. Yeah.
Okay, great. And I guess it's kind of, I mean, in a way, and I was just actually talking to Ann Peters about this yesterday, it'll be good once this is cleared you, because then you'll have some kind of immunity to it. And you should be like safer than most people out there.
We're hoping so. Yeah, right. I would love to be immune to it. As the virus changes over time, I expect that you can be reinfected, but hopefully if I was, it would be mild as well. Fingers crossed. I think there's a lot more research to be done on all of coronavirus. So.
Certainly. Did you notice any changes to your diabetes management as a result of this? How have your blood sugars been? Have you been, doing more insulin, less insulin, trying to drink more fluids? I guess just how have you been managing your diabetes, and has it been different?
Yeah, so I was very vigilant, and actually it was kind of a blessing in disguise that I was home and didn't have anything to do, because it allowed me to really focus on my blood sugars quite a lot. I wasn't expecting them to look how they did. And in fact, I had some of the best days of my blood sugar control over COVID. So I was shocked by that. And I think that's something I shared a lot with my type 1 friends, is that I was not expecting my insulin needs to stay the same. I was expecting them to increase, but I didn't see that. I was testing ketones a lot, because you can still spill ketones when you're sick, even if your blood sugars aren't high. And so I was doing that about every 4 hours just to be sure I was in the clear. Some of the symptoms of coronavirus can also show up as symptoms of ketones. So I wanted to be sure that my headache and thirst and things like that weren't related to that. I also was pushing fluids. That's such an important thing whenever you're sick with anything, to be drinking a lot of fluids. And I also made sure that I was keeping carb intake up. So if I wasn't hungry for a meal, I would, have some carbs through liquid or any way, just to be sure that I didn't start getting fasting ketones.
Right. Can I talk to you a little bit about your work as a nurse? Have you seen patients with coronavirus, or since you've been isolated at home, have you heard of any of the patients at the Barbara Davis Center having tested positive for COVID-19?
Yeah. So what we're seeing is that kids aren't really being tested for it, although they might present with symptoms of it. They're not necessarily being tested. And I actually just talked with Dr. Alonso at the Barbara Davis Center, and he had seen a patient or two that had tested positive for COVID, and they were recovering within a couple of days. Granted, that is unique to each person. We can't expect that to be across the board. But what we're sharing with our patients is the best thing you can do for yourself is, of course, good hand washing, remaining at home, away from groups of people, staying with your close contacts, and then also just really trying to focus in on good blood sugars. Research has shown for a long time that you handle things better when your blood sugars are in control. So if you can take that extra time to make sure your blood sugars, as much as possible, are in range, it really does help a lot.
And has there been an increased level of just like PPE wearing? Is everybody kind of completely head to toe covered, or what is the protocol like?
So right now at the Barbara Davis Center, we're doing most all of our daily visits that we see are all telemedicine. We are still coming into the clinic and doing in-person new onset education, and that's pretty much it that's happening at the BDC. So most of our staff is working from home, trying to reduce contact. We're constantly wearing masks, and we work really closely with the Children's Hospital here, and they're in full PPE and everything, and they make sure that the patients are COVID negative when they come to us for education.
Got it. Was anything, I mean, this is a question not just for having COVID-19, because I feel like we've all been kind of sheltered in place, but has anything been more difficult for you? Like, how have you been getting groceries and just like simple everyday stuff like that?
I'm grateful to have a good support system that dropped off groceries to me. Definitely it is more challenging. It was time for me to get my insulin prescription refilled. And so navigating that, thankfully my pharmacy did mail order. So I set all of that up, but those are extra things we have to think about. not going crazy with the stockpiles, but making sure you have enough food for the next couple weeks, making sure you have enough diabetes supplies at home for the next couple weeks, being sure that your bases are covered so that you can take the time to really care for yourself.
Great. Well, I think you've answered all my questions, Ashlee. We really appreciate you taking the time to speak with us today. Is there anything else you want to say to people out there living with diabetes, people who might be scared that they're going to come down with coronavirus or anything at all?
I think there's a healthy amount of fear to have. Be safe, wash your hands, eat well-balanced meals, take care of yourself, rest. Sleep is so important, but we can't live in constant fear. And so work with your healthcare providers. If you think you have COVID, reach out to them, ask to be tested, but also work with your diabetes care team. If you're struggling with blood sugar management, really reach out to them because they're probably more than happy to help bring your target or your blood sugars back into target range and help you with dose adjustments surrounding illness.
Great. Well, thanks again. I mean, we're definitely happy to hear that you're feeling better. And I know we're all very supportive and thankful for all healthcare professionals. So keep fighting the good fight and feel completely 100% better soon.
Thank you.